What can you do today to prevent pelvic floor disorders? There are different factors, modifiable and non-modifiable. Non-modifiable factors, for example, genetics. You can't change the quality of your tissue. Modifiable factors is what you're actually doing in your life and how it affects your pelvic floor. Smoking or medical condition that you can develop from chronic smoking, constipation, lifting heavy things. So what can you start doing today to prevent development of any pelvic floor disorder? Well, first of all, make sure you maintain a regular bowel movement because straining can predispose you to develop pelvic organ prolapse and incontinence. Eat the food rich in fiber, drink enough fluid. If despite doing all of this you're still experiencing constipation, make sure to talk to your gastroenterologist who can help you fight the constipation. Another important factor is to avoid frequent urination. Avoid going to the bathroom just because you're going for a walk, just because you're leaving the restaurant, because it will condition your bladder that's the volume at which bladder should feel full, will predispose you to develop overactive bladder. Avoid holding your urine for too long. We all have to hold our urine sometimes for many hours, but it's not healthy because it affects your pelvic floor muscles and you can develop some discomfort, some pain, and just some hesitancy when you're urinating in the future. So the healthy frequency is every 2 to 3 hours. But keep in mind, if you drink more, you will pee more. Avoid lifting anything heavy, anything that puts pressure on your abdominal muscles, especially if you just recently delivered a baby. It's becoming more common to do weightlifting as a way of working out. Everything is good in moderation. A little known fact is a lot of Olympic athletes suffer with pelvic floor disorders. Another factor that can affect your pelvic floor is the pregnancy and delivery. Having vaginal birth or C-section, because vaginal birth is one of the major risks for developing pelvic organ prolapse and urinary incontinence. Usually, women become more familiar with pelvic PT after they give birth. But it's normal and it's recommended to go to the pelvic floor physical therapist even before you get pregnant, to evaluate your pelvic floor, to release those tense muscles, and to learn how to use your pelvic floor appropriately. So what can you expect when you go to see pelvic floor physical therapist? You're gonna meet the pelvic floor physical therapist who first gonna talk to you to collect more information on what symptoms you're experiencing and assess how you walk, how you sit, do some external manipulation. And then the very important part of the pelvic floor PT session is external exam and external exercises. When they assess the pelvic floor muscles through the vagina for women and through the rectum for men, they assess every single muscle and see if any muscles needs to be released or if some muscles are very weak, and they train you how to do the exercise targeting those particular muscles. Let's talk about Kegels. Kegels are controversial. You probably heard about Kegels and that you should be doing them a few times a day, every day to be healthy. Well, it's not true. The Kegels are not for everyone. There are women who have a very weak pelvic floor and women who have a hypertonic, very tight pelvic floor. And these symptoms can be very similar, and it can be very challenging to distinguish one from another. That's why it's important to see a specialist to get evaluated and treated appropriately. If you were told by a pelvic PT or urogynecologist that you have a very weak pelvic floor, great, do your Kegels. But if you are someone who is experiencing urgency, frequency of urination, pain with sexual activity, pain with bowel movements, you're not the one who should be doing Kegels. And that actually can make your condition worse. And another interesting fact, Using vibrators is very healthy for your pelvic floor. No matter if you use it externally or internally, it helps to bring more blood flow to your pelvic floor and promotes the healthy tissue. Pelvic floor disorders like prolapse and incontinence are very common, and there are certain factors that you cannot change. But there are certain interventions that you can start doing to improve your condition and prevent them from developing. If you've done all of them and you're still experiencing issues, make sure you see your urogynecologist.